Hello everyone, today we will be talking about the wound healing process. First of all, what is wound healing? Wound healing is a process when the body heals the wound. In dentistry and in other medical fields, dentists and doctors will study the wound healing process. Of course, the wound healing is not a simple process. If we want to talk about wound healing, we have to go so deep in the subject that even 1 hour cannot provide us with a sufficient detail. So we will be discussing the wound healing on a brief discussion today. Wound healing occurs when there is an injury to the body. The wound healing is divided into 4 phases. First is proliferation, then maturation, inflammation, and there is the process of wound healing through other hemostasis phase. Of course, I said that in reverse. So please let's start with the hemostasis. Hemostasis occurs after blood and lymph liquid is squeezed or getting out of the skin of the vessels, blood vessels. This will make the platelets aggregate and clump together. Many mediators like cytokines, histamines are released, allowing the white blood cells and other inflammatory cells to enter the infected or the injured site. Second phase is called proliferation, or let's start with infection or inflammation, which occurs because of the inflammation or because of the infection. This phase, there are many cells contribute to this phase, including the neutrophils, mast cells, monocytes will become macrophages in later stages, and even epithelial inflammatory cells. All these cells provide phagocytosis, cleaning of the wounded area, releasing of IL-4, 11 and 14. This is for macrophages, of course, and will clump together with the platelets and provide a frame covering the wound. Next, there are the phase of not inflammation. We finished hemostasis, we finished inflammation. Now proliferation. Proliferation phase occurs at between 5 to 7 days after the injury occurs, and it includes the phase of which the new vascularization and reepithelialization occurs. Reepithelialization meaning a new epithelial layer is formed on the wound. New vascularization is divided into angiogenesis, which is formation of blood vessels or new blood vessels out of the old blood vessels. This was angiogenesis. And the second is vasculogenesis, which is formation of new vessels out of endothelial progenitor cells. After the proliferation ends at week 3, third week, the maturation phase begins. On this phase, the phase of maturation, the wound is completely filled and contracted. It reaches after 12 months of maturation to an 80% strength of its original strength before the injury. The wound at the week 3, it reaches its maximum contraction, and it may continue to more maybe 5 to 6 weeks after week 3, and we say that it continues to the 12 months. Of course, the wound at the beginning, the hemostasis, it was contracted. The blood vessels contract at the beginning of the hemostasis phase. But soon after, a vasodilation occurs. But this time, at the maturation stage, only wound contraction occurs. During the wound healing process, there are many aspects like systemic and local effects affecting the wound healing process. Starting with the local factors like edema, an enlargement, a swelling, pressure that is performed on the wound, preventing it and maybe causing necrotic and debris at the wound, preventing its healing process to go fast. Shape of the wound, type of the wound, size of the wound play a role, as the circular shape wound takes a longer time to heal up. Other aspects or local aspects includes oxygen provision to this area. Oxygen existence kills bacteria, and ATP needs oxygen for the nutrition of cells that are in the wounds to allow them to kill bacteria and do the phagocytic activity. Now, after we finished with the local, which are number of wounds are important. If there is less wounds, of course, a faster wound healing will occur. But if there are many wounds, it will take longer for the wounds, for these many wounds to heal up. Next is after the local, we finish the local effects on the wound, which include maybe even temperature. Temperature at the periphery of the body is reduced 1 to 1.5 Celsius, which can delay wound healing. Then, after we finished the local effects of wound healing, we move now to the systemic effects of wound healing. Systemic effects, also oxygen existence is also important, as some patients having diabetes could have cancer, could have especially type 2 diabetes affects the wound healing process, as it reduces oxygen on the area of the wound. Aging, after aging, it can delay the wound healing, but exercise can reduce or increase the time of the wound healing with old people. Using of medication, some types of medication like non-steroidal anti-inflammatory diseases, drugs, anti-inflammatory drugs, or even steroid drugs and chemotherapy drugs reduce the wound healing. Although they provide reduction in pain, but at the same time they can reduce the wound healing process, especially non-steroidal anti-inflammatory drugs, which increases the scar formation. And its use is controversial. Obesity, stress, alcohol consumption is some of the systemic effects that delay wound healing. Now we summarize what we have mentioned in this lecture. First, we talked about the wound healing, hemostasis, proliferation, maturation, inflammation. Then we talked about the effects on wound healing, local, like wound shape, size, type, number of wounds, temperature, even suffocation or ischemia could delay wound healing. Then we talked about systemic problems of the patient that increases or delays wound healing, aging, alcohol consumption, obesity, stress, diseases like ischemia or like diabetes also delay the wound healing. Thank you for listening to this lecture, and we will meet in other discussions on such subjects.